would like to introduce to you Amy Nelson. Amy is an occupational therapist and certified hand therapist. Now, it's been a couple of years that Sue Light and I talked about getting a therapist in to talk with our group about good body mechanics, how to work better and smarter and not hurt ourselves, because some of us have replaced more than a few joints. 2 hips, a knee, and a rotator cuff repair. So, but it doesn't stop me because I had some really amazing therapy when I had my surgeries. So Amy has over 22 years of experience specializing in treating upper extremity injuries and conditions affecting the musculoskeletal and nervous systems. She has a passion for quality improvement in healthcare and recently pivoted into a non-clinical role at UCare, and that's where we met. In Amy's free time, she enjoys dragon boat racing, traveling, and caring for her small garden. So thanks, Amy.
Yeah. Thanks, Jean. And thanks everyone for coming out tonight. We got a pretty good crowd. Can everyone hear me okay? Okay. I know I have a quiet voice, so if for some reason you're having a hard time hearing, just wave in the back or something like that, and I'll try to adjust my volume. Okay, mic closer, is that better? Okay. I named my talk Gardening for Life because as I was thinking about this talk, I was thinking, about how gardening is one of those activities that can really be scaled from starting when you're real young up till, you're in a wheelchair, super old. You can scale it up, scale it down. You can do it alone. You can do it with someone. And I remember my first experience with gardening was in kindergarten when we got the styrofoam cups out and we put dirt in there and we planted our first seeds. So that's one of the reasons why I named it Gardening for Life, because I'm hoping that I can teach you some concepts tonight to help you garden for life. Okay, I did come up with a few objectives for tonight just to kind of keep your mind focused. Number 1, understand good body mechanics to apply to gardening and all other daily activities, because the concepts that I teach you tonight can be used for anything that you do throughout the day. Demonstrate what size tool handle is optimal for your hand, and learn at least 3 ways to work smarter, not harder. That's a phrase that I use at least 5 times a day when I was in patient care. Work smarter, not harder. So just an overview of my talk tonight. We're going to be talking about very briefly gardening pros and cons, and you guys can probably come up with some on your own. Some exercises, and then going into body mechanics, ergonomics, joint protection, energy conservation, and some of those things overlap a little bit too, and that's okay. I'll talk a little bit about equipment and tools, and then injuries, what to do, how to get help, and then a few resources at the end. And I'm happy to answer all your questions. I can leave my email with Jean as well if you think of something later. But let's hold the questions to the end if you don't mind. So according to a meta-analysis done recently, the pros of gardening are improved psychological health, physical health, and social health. So that is looking at independent studies to determine an overall trend in gardening. So the activity that you've chosen to spend a lot of time on is probably one of the best activities you can do. The cons, well, injuries happen. Like Jean says, she's had a few joints replaced. More than 400,000 gardening tool related injuries are treated in the emergency rooms each year. And that's just the gardening tool related injuries. So one way of avoiding those injuries is to look at exercise. So most of the time, we're really busy in the spring, summer, and fall, but not a lot of people have activities, do as many activities during the winter, I should say. So we see a lot of injuries occurring in the spring, and people get a little deconditioned in the winter unless they have a winter activity. And that's usually when people become injured with those soft tissue injuries from overworking weaker muscle groups. So exercise is important to do to prepare for gardening activity. and not just look at gardening as your exercise, but think of gardening as any other type of sport. You have to prepare for it to minimize your risk of getting injured. We have this saying in dragon boat racing, that's what I do in the summer. Get fit to paddle, don't paddle to get fit. And it's the same concept. You want to condition those muscles before you get down to the work. So I just kind of wrote a list of some off season. I'm calling the winter your off season, right? Maybe some of you do some gardening activities inside in the winter, I don't know. But just find an activity, a physical activity that you enjoy to do. And some examples, walking, yoga, Pilates, weightlifting. The CDC recommends 150 minutes per week of moderate intensity aerobic activity. That's about a half hour, 5 days a week. And then 2 days of muscle strengthening, and that's recommendations for adults. So if you think about just getting older, it's been on my mind lately because I turned 50 this year. It was a milestone. Yeah, it's kind of hard to believe. But according to WebMD, you lose 3 to 5% of your muscle mass for each decade of life past 30 if you're inactive. So if you're active, you still can lose muscle mass, but just not at the same rate. So it's really important to keep your strength and conditioning going throughout the lifespan so that you can stay independent, not only with your self-cares and taking care of your home, but also the hobbies that you enjoy, like gardening. Does anyone have any activities that they enjoy in the winter time? Go ahead. Oh yeah, that's a really good exercise. Yeah, and that gives you that aerobic exercise. That's great. So I posted some exercises up here that are kind of some good ones to do as like a warm-up before and after you garden. Just kind of getting some of those general muscle groups. And this came from a stretching book that I referred to a lot. You can probably see at the bottom of the screen there is the reference. And you're welcome to print this page. But this actually, if you do a couple reps of each of the exercises, it's literally like 4 minutes. So very quick. Are we getting some noise? Okay. So the first one, I just want to talk about exercise number 1, because I don't think it's real obvious what's going on in that picture. And that exercise is just kind of slightly, I'm going to try to demonstrate for those of you that are here. Just bending your knees a little bit, and just kind of be mindful of feeling your quads turning on, and your hamstrings should be relaxed. And that's just kind of an exercise that's kind of called contract relax, to bring your awareness to those muscle groups. So that's all number 1 is. And then number 2 is just stretching your calves, so like so, with a straight leg in the back. Does anyone have any questions about any of those other ones on there, or is it the rest of them pretty self-explanatory? Okay, and just one thing about doing stretching. I treated like 50 patients a week for like 22 years, and I met a lot of people, but a high percentage of people seem to think that more is better. And with stretching, really less is better. You just want to get it to a mild stretch and then hold it there. You don't have to crank on your joints. So what I usually tell people is to go to where you think and then back off a little bit. Just a mild stretch. Getting into body mechanics, and just to kind of define that a little bit. Most of you probably know this. It's a term used to describe the way we move as we go about our daily lives. It's how we sit, how we stand, lift, carry, bend, and sleep. So I put some general concepts on here, and I can demonstrate some things here, and I'll try to describe that for the folks that are on Zoom that can't see me. But basically, you want to try to maintain the natural curves in your spine when you're moving, sitting, laying down, any of that. Generally, the best area to work is between the shoulder and the hip height as far as with your arms. You want to avoid working overhead for prolonged periods of time because it's very hard on your shoulder joints.
Am I good?
And then typically you are also looking up, which can be very hard on your neck spine. Using your body weight to push an item is always better than trying to pull it because you can use the whole force of your body and the weight of your body. Does anyone know proper lifting techniques? Has anyone ever learned that? Bend your knees. Anyone else? What's that? Don't lift with your back. Yeah. It seems like a lot of us learn proper lifting techniques, but we don't really talk much about proper use of your arms. But yes, you want to, when you're lifting something from the ground level, you want a wide base of support, kind of point your toes out just a little bit, squat down, get the weight close to you, and then use your legs to lift it up. You want the weight as close to your body as possible. That reduces the strain on your back and your arms. Work with your arms as close to your body as possible. I mean, talking a little bit about anatomy of the arm. Basically, your wrist extensors are a lot weaker than the wrist flexors. And your elbow straighteners are a lot weaker than the elbow benders. So if we know that general concept, what muscles are better to use? The stronger ones, right? The flexors. So if we're trying to lift something and our arms are straight out, and especially if you're palm down, you're going to be isolating those weaker extensors. But not only that, with having the arms straight, first, you're stretching out the muscle, and then when you lift something, the muscle is shortening. So that puts a lot of strain on your tendons that attach your muscles to the bone. So what happens with that movement? Well, a lot of times people get tennis elbow. Tennis elbow is actually an irritation of the tendon of your wrist extensors that attach to the outside of the elbow. So mainly people feel pain at the elbow. That can be alleviated from changing how you use your arms, working with your arms closer to your body. Bent elbows are happier than straight elbows for that reason. Also, your bicep is one of the strongest elbow flexors, along with your brachioradialis, that can withstand a lot. Also, when you look at gripping, the best position for gripping is with a straight wrist. Now, I want you all to try something with me real quick. I want you to bend the wrist forward like this. And then I want you to go ahead and trying to make a fist with your wrist bent forward. Okay, feel good? Not so much. Now, straighten your wrist and go ahead and make a fist. What feels better? Straight wrist or bent wrist? Straight wrist. All right, it's so simple, right? Not only that, the way our body is hooked up, our finger flexors and such, when your wrist is bent and you're trying to grip something, you lose about 25% of your grip strength. So you're going to be stronger in that, what we call a neutral wrist or a straight wrist, be straight or just slightly tipped back. Your wrist is going to be stronger. The other thing is, if you're gripping with your wrist flexed, that also puts a lot of pressure on your nerve that crosses the wrist there, your median nerve. And when that nerve gets unhappy, we get carpal tunnel syndrome and having some numbness and tingling in the fingers. So keeping the wrist straight helps to avoid excessive pressure on that nerve as well. Now getting into the forearm position. Best position is with the forearm in a neutral position. Now I'm talking, I like to say good, better, best. Are we able to do the exact perfect position with everything that we do, every gardening task? Every time we mulch our entire yard and garden in one day, are we able to do that? Planting our entire garden in one weekend because we're so excited it's spring? No, we're not. So I like to think good, better, best. Just do the best you can, okay? So one example I thought of for this, well, number one, with lifting, when you're lifting, you bring the weight close to you, your forearms are in neutral. That's using your stronger brachioradialis elbow flexor. And then also, there are some gardening tools that you can get that are more of a pistol grip that can position your forearms in a neutral position. But that neutral position just really helps to keep the muscles and the nerves from getting overstretched and overstrained. So if you are changing forearm positions occasionally, that's fine. We're just trying to do the strongest positions as much as you can. So like I alluded to earlier, try to avoid working with your palms down. And well, this next one with your palms down and your elbow up. So what I was trying to come up with that, if you're doing any kind of cutting and you're cutting like this, and the people on Zoom can't really see me, but if your arm is winged out like a chicken wing, okay? Can the people on Zoom kind of visualize that? That's what to avoid. That really strains a lot. Your radial nerve, which runs along the outside of your elbow, down the back side and into your hand, can become very unhappy, as well as some of those weaker wrist extensors that we talked about. So again, the best position is forearm neutral, so your thumb's going to be up. That's how you can help to remember, thumbs up. And two, then getting to the spine that we talked about, you have 4 natural curves of the spine that you want to try to maintain. We don't want to try to make a new curve in the spine by rounding your back. That gets you into trouble. So one of the other techniques with, trying to pick up something from the floor, if you don't want to squat, there's a technique called the golfer's lift. Does anyone know that? I guess maybe golfers do this when they pick up their golf ball. I'm going to demonstrate it for the people on Zoom. So I'm just basically going to kick out my one leg. And basically you're on one leg, and then you're kicking out the other leg to pick it up. And that also keeps your back straight. So you could try that for lighter weight objects. So really, like we talked about, trying to minimize overhead work. It's really hard on your arms because usually you have, like in this picture, the palms are down, right? The elbows are fully extended. So you're really using your body at a disadvantage here. Not only could you possibly get injured, but you're using a lot of excess energy. So instead of reaching to prune a branch, try to use your other hand to bring it in towards you and then clip it. Or if you need to, get a ladder. So like I said, there will be a little bit of overlap between some of these topics, but getting into ergonomics, I'm sure we've all heard about ergonomics. Like you go to the store, the gardening store, and it's like, oh, this new ergonomic tool, I got to get this. This is going to be the answer to all my problems, right? It's ergonomic. yeah, it's got to be the best. But ergonomics is an applied science concerned with designing and arranging things people use so that people and things interact most efficiently and safely. Do you think a tool for someone that's 5'1" is going to be the same ergonomic tool for someone that's 6'7"? But it's called ergonomic. It's on the package. It's ergonomic. It's got to fit everyone, right? No, in my opinion, it's kind of a marketing term. You have to look at the person, and then you have to choose the right tool for the person to fit them, not fitting the person to the tool. So, just talking about hand tools. There's different length handles. If you get one that's too short and the end of the handle is pushing into the meaty part of your hand, just down from the small finger, and you're using that repetitively quite frequently over the course of a weekend or two, you could get a little bit of irritation of your ulnar nerve, which goes through a separate tunnel through that side of your hand. And this, just for the people on Zoom, that's the side of your hand, your small finger side, down from the small finger before you get to the wrist, that meaty part of your hand. Your ulnar nerve goes through that little tunnel there. So we like to see the handle of the tool extend across the entire palm so that you don't get that extra pressure on your ulnar nerve. A lot of times, people that do long distance bicycling will get irritation of that nerve because they're constantly having pressure on that side of their hand. So I should probably just point this out. I don't usually recommend like specific tools to people. I try to keep it to trying to teach you about the different features of the tool, and then you can decide what works best for you because everyone has a different shape hand, length, fingers, body type, and budget. So I didn't put specifics in here on as far as brand names and such, but I'm just kind of touching on the different features. So one feature I really like with hand tools is the ratcheting, because you don't have to squeeze it as hard. It doesn't put as much pressure on your finger joints. And then looking at the handle thickness, if you make a circle using your thumb and your index finger, so you have a circle, that's a good diameter handle for you. Okay, if you get something that's bigger, you're going to be straining to hold on to it. If it's smaller, you're going to have to grip it tighter to hold on to it. So that's a way you can kind of see, and it doesn't have to be perfect, right? Close. But that's how you can decide on the handle thickness. And then the rubberized grip is always nice because it keeps your hand from slipping, so you don't have to hold it as tight. Now, if you have some tools that you love that are with wood handles, and you have a pair of gloves that have little rubber, what do you call them? Gripper thingies on the palms, that's also gonna keep you from slipping, so you're good. I'm not here to tell you that you can't use your favorite gardening tool. So I kind of mentioned a little bit ago about when we were talking about trying to minimize reach. The long-handled and the telescoping tools are great for that. It helps to maintain a more upright body position. It helps to minimize your reaching. And then when we look at ergonomics applying to body position, try to fit your work to your body and not try to work your body around your work type of thing. You know what I mean? I will see my neighbor working in her garden sometimes. And instead of, she has like a slightly raised garden, okay? instead of getting up and walking to the other side of her garden so that she can weed over here, no, she's practically laying across her garden with her arms reached out so she doesn't have to move. And I don't want to be that neighbor, like, hey, that's not good body mechanics. But I'm just cringing because I'm her neighbor and she likes to ask me for advice. I'm like, give it another 6 months. She's gonna be asking me about what to do because her elbow hurts. So I did end up having to say something to her. Get up, walk around the garden so that you can read with your arms closer to your body, right? That's one of the concepts we learned earlier. Also, you always want to face what you're working on so that it avoids twisting your spine. And I guess we're talking again, move closer to what you're working on. I like to repeat myself a lot because it helps you guys to remember stuff. There'll be a quiz at the end. So the other thing is make sure you're moving your feet. With my neighbor, I don't know, she just likes to stay in one spot. But whether you're weeding, you're raking, you're hoeing, you're sweeping, move your feet so that you're using the momentum of your body. You're using the weight of your body to help with the task. If you're planting your feet, now all the stress is on your arms, right? And you lose that mechanical advantage of the rest of your body. So I like to think of it, when I was typing this up, I was gonna say, move your feet like you're dancing with your hoe. But then I thought, that doesn't sound good at all. So don't dance with your hoe, but dance with your broom, dance with your rake. Move your feet, move your feet. Now, one thing us hand therapists like to talk about is joint protection. And there's a little overlap with energy conservation and biomechanics, body mechanics with this as well. But it's basically a series of techniques that can be included in all daily activities to reduce stress on your joints. Why do we want to reduce stress on our joints? Anyone have a guess? Keeps us happier. They last longer, yes. Nobody wants Uncle Artie to come and visit, which is one of my old patients called her arthritis, Uncle Artie. Whenever she had a flare-up, she's like, Uncle Artie is coming to visit. So one way we can incorporate joint protection is by using 2 hands instead of 1. And this transfers a lot of the weight amongst more joints and less on any particular one. So if you're lifting, let's just say a bag of potting soil, you can lift that with 2 arms instead of 1. If you're lifting a gallon of milk, you can have 1 arm on the handle and 1 arm underneath, palm up, to help to support that weight. Or if you're lifting a pot, 2 hands. You want to think about using the largest joint available for anything that you do. So if we're able to use our stronger elbow and shoulder joints by hugging a weight, if it's a little bit bigger, why wouldn't we do that? Think about your grocery bags. I see people carrying like 55 bags on one hand, so they can make 1 trip going from the car into the house. Just make a couple extra trips, It's good to get your 10,000 steps. So another concept is avoid staying in one position for too long. So our joints are considered like synovial joints. They get lubricated when we move them. So if we're sitting in one position for a long time, they just dry up and get stiff, and then we try to move them and it's not super comfortable. So it's good to change positions frequently, no matter what you're doing. And anytime that you can use a tool to take pressure off of your body, like I said, it's good, better, best. Better to use a tool if it takes stress off your body. Avoid tight, prolonged pinching and grasping. So one thing with a sustained grip, and it can happen where you start to feel like some numbness and tingling. That just puts a lot of pressure on what we call your carpal tunnel, which is at the base of your hand where your median nerve lives. And if you're gripping for a prolonged period of time, that compresses that nerve. The nerve can become unhappy and give you problems with numbness and tingling. Also, you just want to give your muscles a break occasionally. So it can be as simple as put the tool down, open and close your hand a few times. Pick the tool back up, go back at it. You know, it doesn't have to be a long break, but it's good to take some breaks. Alternate heavier tasks with lighter ones. And you can think about this when you're planning out your day. And how many of you plan out your gardening activities before you run out there to do it? Anyone? Okay. So, or like how many people are just waiting for a good day and then you run out and get as much done as you can? Yeah, all right, some people in the audience, that's funny. So for those of you that like to plan, think about this. So if there are some activities, some heavier, some lighter, especially good if they use different muscle groups, alternate them because you will maintain better energy throughout the day. And while you're switching tasks, you'll be giving a different muscle group a rest. Now I put this slide in there just because thumbs need special care. Thumbs are kind of one of those things that separate us from the animal kingdom, right? They're kind of special because they move so many different directions, right? And they're pretty important in the function of your hand. Would you agree? Without your thumb, your hand is just a paddle and you can't do as much. So just remember, whatever you're pinching at the tip of your thumb transfers 12 times the force to the base of your thumb. And the base of your thumb is that joint right in between your thumb and your wrist. So we consider that you have 3 joints of the thumb. That's what we call your CMC joint or your carpal metacarpal joint. And that joint really wears out in a lot of people. It's pretty common to get some arthritis in that joint, especially in women. Women get it more than men, but there are men that do get it as well. So if you're thinking about that, I would not highly recommend this tool that's really isolating the thumb. I mean, it would be okay if you're alternating this tool with a, using this for a little bit and then alternating to another tool that used your fingers and then just kind of alternating back and forth, that would be okay. But if you're primarily using your thumb for all the cutting like this, I would be very concerned about the base of your thumb. And it's because the thumb moves so many different directions, it's inherently not as stable as some other joints that just bend and straighten. So there's a lot of surface area that you can wear down on the cartilage. How am I doing on time here? Oh, we're pretty good. Okay, moving into energy conservation. Now we kind of touched a little bit on this with some of the other topics, but this basically is to prevent wasting energy. If you think about your energy level as being a bank account, you can only withdraw however much you have in there, right? So if you can save a few bucks so that you can do something that you really love, why not? So some ways to conserve energy: pacing yourself and prioritizing. So when I went to occupational therapy school, we learned a concept called activity analysis. And that is the way you can break down absolutely any activity into smaller steps. And I think the task we had was break down making a sandwich. And we literally had like 3 pages of steps because we had step 1, walk towards the refrigerator, open the refrigerator, get out the meat. I mean, you can break down any activity. So if you look at what you have to do in your garden, if you're having to do a lot, try to see if you can just break that up into smaller steps. Incorporate a rest break in between. Maybe incorporate a whole half of a day to rest in between if it's a heavy activity. Prioritize so that you do the most important thing first. So another way you can conserve energy, obviously, is to sit down while you're working. Avoid full sun exposure, so working early and late. I'm sure a lot of you have figured that out. And like I mentioned, incorporate rest breaks. Using good body mechanics actually saves a lot of energy as well. You're using your body to its mechanical advantage. Using the right tools. So if you have a good ratcheting tool, you're going to be using less strength and you're going to be able to work for longer than if you're just using one without that feature. And like we mentioned, preparing and planning. If you go into your activities blindly, you know, it might work or it might not work. You won't know until you get too tired to do the cleanup. And you got to get your spouse to do it for you. And they're not going to be happy about that. So talking a little bit about equipment or tools, one thing that's important is protection for your hands, your eyes, your skin, your lungs. Your hands especially. There's a lot of bacteria that live in our soil, right? There's thorns on some flowers, right? I have a lot of rose thorns. And it doesn't take much. One little prick, you can develop an infection. We see this, I saw this a lot in hand therapy. I had a patient that basically got a sliver, and the next day her finger was infected. And then she waited a couple more days before it ballooned up and started turning red and streaking up her arm before she came in. So it's important to protect your skin to avoid those injuries where you could potentially get an infection. Also, if you do get some swelling or redness, do not wait that long to get in. Don't wait until it's streaking up your arm. Go in right away. So we talked about the size of the handle already. Make an O with your index finger and thumb. That's ideal with diameter for your hand tools. And the length of the handle we talked about already. Also, you want to, I really believe that anytime you buy a new tool, you need to be able to pick it up. You feel it, see how it's balanced, the weight of it. You want something lightweight, but that's strong and durable. Then you want a tool that helps to facilitate good joint alignment. So one thing is with looking at your wrist, we talked about it's ideal to work with your wrist straight. Well, when you're digging, I see a lot of people like twist their wrist, if you're getting your thumb tendons and your little sensory nerve. Over time, you can develop what's called tenosynovitis, which is inflammation of the little bursa that's in there. And that doesn't feel good either. So one way to avoid that is to work with your wrist straight. And so you can get some different shaped handles to help to facilitate that.
I'll try to.
How many people are cleaning up and sharpening up their tools now to get ready for next season? Yay, good job, Jean. One person. Please make sure your tools are sharp and clean them. And then looking at manual versus electric, obviously some of the electric tools are going to be easier on your body. But you gotta be careful and know what you're doing because they also cause more injuries if you don't know what you're doing. Okay, so just, getting into protecting your hands more. One thing about when you're fitting gloves, you don't want them too large. I know some women are like, oh, I just grabbed my husband's leather gloves, it works fine. But if they're too big for you and you're having to grip through extra bulk, you're just adding more resistance to your finger flexors and your hand's gonna fatigue out sooner than if you had gloves that fit you. So size matters. You don't want them too small, that's gonna restrict your finger range of motion. And then, pick some gloves that are appropriate for what you're working on. If you're not working with thorny rose bushes, you might not need the full leather glove. You might need, something a little thinner. So there's gloves for protection and then there's anti-vibration gloves. So if you're using vibratory tools a lot, you might want to consider the anti-vibration gloves that has the material in the gloves that help to protect your nerves against the vibration. How do you pick the best diameter handle? Yes, all right, so you guys got that already? And here's just a picture of handle length, that's pretty good, almost completely across the palm there. Anyone familiar with grip sticks? Okay. Well, I ran into them at the Minnesota State Fair a few years ago, and they actually they're plastic and they help to seal up bags, but then they also have the ones that have handles attached. So I think it works well. The seal part works well so that people don't need to be pinching using a traditional chip clip and they can just slide on and slide off the grip stick. But also I like the ones with handles because then it's just a little easier to pick up. And grip stick is spelled like it is up here. They spelled stick, S-T-I-C-S. And you can check it out more on gripstick.com. I should have brought some tonight because I really like that. All right, so protect your wrists. There's just a lot of bones and a mess of ligaments on your wrists. So keeping your wrist straight is going to help you have the most strength with your fingers and your wrist. And helps you to avoid compression on your median nerve. Also helps you from straining your thumb tendons. So the thumb tendons that cross over the thumb side of your wrist are the tendons that lift your thumb up and that bring your thumb out away from your hand. So those are the two tendons that can get irritated if you're working with your wrist bent towards the small finger. And like I mentioned earlier, tool design can help to facilitate keeping your wrist straight. The other thing is, when you're pushing up, like if you're sitting on the ground, people tend to push up with their wrist extended, and that's not really a strong position for your wrist. So it's better if you go up on a fist so you can keep your wrist straight. And here's an example of one of those pistol grip handles that can help to facilitate keeping your wrist straight, as well as keeping your forearm in a neutral position. And by neutral position, I'm just talking about you're not palm up or you're not palm down, you're right in the middle. That's what I call the handshake position. Couple ideas to protect your knees. Anybody use knee pads? Oh, wow. So here's just a couple examples. Putting on the knee pads, then you don't have to drag this little rectangle around the yard with you. It's a little bit more convenient. And protecting your feet. So looking at shoes, you want something that has deep treads that are waterproof, non-slip, and protect the upper part of your feet and your toes. I'm not totally against flip-flops on the beach, but when you're gardening, you want some protection. So some other considerations. I guess I'm repeating myself a lot. I didn't realize that. When you're doing groundwork, use long-handled or telescoping tools to minimize your reach, or get up and move to the other side of your garden. Minimize looking up or tilting your head back so you're not straining your neck spine. And try to maintain the natural curves in your spine when you're sitting, lifting, standing, or walking. And when you're kneeling, it's better to be on one knee instead of two, because if you're kneeling on two knees, you have a tendency to bend at the waist and not the hips, and that you're not keeping your back straight, then you're rounding your back. You're trying to put a new curve in your spine. So for soft tissue injuries, I'm sure a lot of you have heard about ICE, RICE, PRICE. It's just an acronym for what to do if you get a soft tissue injury. You rest it, you ice it, you compress it, you elevate it. And by elevating, you want the body part that is injured to be above your heart. So if it's your hand, you want it up. Well, the Canadians came up with something a little bit better. And they call it, the acronym is peace and love. Because they determined that, okay, well, RICE, that tells you what to do in the beginning, the first 1 to 3 days, or the first 1 to 2 weeks, but it doesn't really tell you what to do after that. So they came up with a new acronym, mainly for therapists to pass on to their patients. And I just like the name of it, peace and love. When you get injured, don't you want peace and love? Just love that body part to get it back to normal. So the peace part is kind of similar to RICE, where you want to protect the injured area, you want to elevate it. And they're recommending avoiding anti-inflammatories. So you can let your body do its natural process, okay? Because our body develops inflammation in order to protect an injury. You do want to use compression to help with the swelling. And then the education piece is more on the therapist, if you see a therapist. But, educating yourself on the type of injury you have, if you don't know, and you see your primary care physician, then you might learn a little bit about what not to do or how long to rest it. The love part comes once the inflammatory phase is over. You can start gradually loading that area of injury in the pain-free type of load, though. Listen to your body. And we don't talk about this often enough, but people's attitude towards their injury makes a huge difference on recovery. You do hear it a lot with cancer recovery. People that are positive generally do better, but you don't hear it with other kinds of injuries. Be optimistic. Your body knows how to heal itself. Give it an opportunity. Give it time to rest. I would see a lot in my clinical practice. I injured myself 3 weeks ago and I didn't have pain anymore, so I started bench pressing 50 pounds. And now it hurts again. I don't know. Gradual, people, gradual. Maybe start with a lighter weight, see how that feels. And then vascularization, see if I can say that. That's, working on increasing your aerobic activity to help get more blood flow out to the injured area to help with the healing, and gradually ramp up your exercise. So next time you get injured, just think, peace and love. Okay. So like Jean mentioned in the beginning, I am a certified hand therapist, and there's only a little over 6,000 of us in the country. We are very fortunate in the Twin Cities to have quite a few. South Dakota, on the other hand, I believe only has like 2 in the whole state, but we're really fortunate in the Twin Cities area. So if you ever feel like you need to speak to a hand therapist, you generally need an order from your physician, a physician assistant or nurse practitioner. And then you can look up on the Hand Therapy Certification Commission website, htcc.org, click on locate a CHT, put in your name of your town, and it will come up with a therapist in your area. Okay, there are some health organizations that are putting on their website a therapist that's a hand therapist. That doesn't necessarily mean that they're a certified hand therapist. So a certified hand therapist is the gold standard. They can do custom splinting, they can do some custom treatment focused on your activities, and they're really a specialist in the upper extremity.
Get the water turned off outside.
I put some other websites on here that I thought would be helpful. The Arthritis
I lost
Foundation.
the video.
And people on Zoom, please mute yourself. The Arthritis Foundation, they have a program called Ease of Use. And what they do is they try out different tools. They have experts try them out, and then they have patients with arthritis try them out and get feedback. And it's a pretty stringent program they run these products through. So they do have it on their website. The products that pass the ease of use will get that award to them, and they'll put it on their website. That means that they've already vetted those tools. And I've never been unhappy with any tool I've gotten that I originally found on that website. My feeling is you don't have to have arthritis to use a better tool. You can use a better tool to prevent arthritis, right? Also, the American Occupational Therapy Association, they do have some articles on there about gardening, as well as the American Society of Surgery for the Hand. Also, the American Society of Hand Therapists, they have some gardening tips and tricks if you guys want to check those out. And here's a picture of the Minnesota Landscape Arboretum's not too far from my house, and I love going there when the tulips are blooming, so I wanted to put that in here for you guys. Thank you so much for your attention, and I'm happy to take any questions that you guys have. He was working in a friend's vineyard, and he was working kind of with his hands at shoulder length, shoulder height, and he noticed after a while he started having pain between his shoulder blades. Well, funny thing is that your arm actually starts at your shoulder blade. So if you're having your arm up, especially if it's like a half a day type of thing, you're probably fatiguing out the muscles and then using your upper traps to try to compensate, to keep going and rotating up those shoulder blades. Get a little closer. And because when you're reaching forward, also you're what we call protracting your shoulder blade. So you're sliding it forward. Or, you know, if you would incorporate some rest breaks and doing some of those exercises, lifting up the shoulders, relaxing, or just squeezing your shoulder blades together, you know, incorporate some of those throughout. That probably would have been helpful too. Does that answer your question? Yeah. Okay. Anyone else? Okay, go ahead. She was saying that she overfills her wheelbarrow and she can make it downhill fine, but going uphill, she has to turn around and walk backwards, and then she can pull it up the hill. And I totally understand this because I had to do this with my brother's power washer that I borrowed that was super heavy. It was commercial. And I did the same thing because you know, you're leaning back and you're using the weight of your body to pull that up. And I have to ask you, are you using a regular wheelbarrow or do you have one with 2 wheels in the front?
I have both kinds. I do it with both.
Okay, yeah, because having more wheels helps because you do have to use a little bit more strength if you just have the 1 wheel on the front. So that's another thing to consider, which one you choose. I wouldn't really care if it said men's or women's. I would try it on and see how it fits your hand. I mean, I have really big hands as well. I have really long fingers. But what I notice with men's gloves is the palm is a little bit wider too. So sometimes there's a little bit too much space on my palm. The length of the fingers might fit okay. But just try it on. Anytime you're buying gloves, you want to try it on. Anytime you're buying tools, you want to handle that tool and see how it feels in your hand. We spent a lot of time talking about the physical benefits of gardening, but there's also some psychological aspects of getting outside in the nature and gardening. Also with the social aspects, getting together with other master gardeners can help with that social aspect. And just knowing your own body was the comment, and listening to your own body. Knowing when to quit and discussing with other master gardeners. And that's a great point. And I'm glad you brought that up, because I wanted to remember to mention this. You guys are the experts in gardening. And you guys probably know so many tips and tricks, and there's quite a few of you. So it would be great if you guys could get together and share anything that you've learned that works for you. That's what I would tell my patients. Because, I had patients that have every kind of hobby, every kind of job under the sun. Talk to your people and see if they have any recommendations. Because you'll be surprised, if you're looking at a tool, see if anyone else has that tool. If they like it, can you borrow it for the weekend just to try it out? Help out each other. Thank you so much for your attention.